Hi, everyone. Thanks for joining us. I'm just watching the participant number climb, so we'll just give it a minute for everyone to come in. All right, thanks for joining us. If you're just dialing, I'm just going to give it one more minute, I think, because people are still joining. All right, I think I'll go ahead and get started. Hi, everyone. Thank you so much for joining us today. My name is Crystal Ramos. I'm part of the Learning Community team, and we are so happy to welcome you to our Learning Community Member Spotlight. We hope to have a variety of opportunities for many of you to share your work with one another throughout the project, whether through webinars, the web platform, or communities of practice that we plan to start, and we'll talk a little more about at the end. But just some Zoom info before we dive in. So if we go to the next slide. So you've all been muted upon entry of this session, but if you have any questions, we ask that you please enter into the Q&A, and I will field the questions to the speakers, as many as I can. If we don't get it answered during the session, we'll get it answered for you and post it on the website later. Also, I just wanted to point out the chat feature, I believe, is available, and we really encourage you to use it to chat among yourselves. For example, if you want to share similar experiences, or if you've had a different experience than whatever you're hearing about, if you want to share a useful link, please feel free. Though it probably goes without saying, we just wanted to mention to please be civil when chatting, and we're all in this together. We want it to be a safe space where we can share different perspectives and learn from one another. Also, please do not put questions into the chat because we won't be monitoring it, so we might not see it. So the questions for the speaker should go in the Q&A. Finally, as with all of our learning events, we will be recording this event, and I'll put it on the website, but also since not everyone has been onboarded yet to the website, we will send it through an email, so you'll get it from whoever you're used to getting learning community announcements from. And finally, if you have any technical difficulties, please send an email to our community manager's inbox, faxequitylearning@urban.org, and someone from our team will be watching the inbox and help you as quickly as possible. So we're really excited to feature 3 learning community organizations today and what they're doing. And just so you know, we selected work that aligned with the type of information we saw a need for in our onboarding survey. So that's how we came on these topics today. So our first speakers I'd like to introduce are from Eastern Michigan University Center for Health Disparities, Innovations, and Studies. And they will be talking today about listening sessions and surveys to understand hesitancy and access issues in East Asian communities. So from there, we have Alice Jo Rainville, Su-Wing Wu, and Olivia Ford. After that, we will hear from Kristen Hobbs from the Center for Sustainable Healthcare Quality and Equity. She'll be sharing about their work to provide resources that can be used to develop and equip health champions. And then after that, we'll be hearing from the Community Alliance for Research and Engagement. So from there, we have Bernard Macklin, Jessica Anusin, and Jackson Higginbottom, and they will be talking about how they plan for and held mobile vaccine clinics. So without further ado, I will turn it over to our first set of speakers.
Thank you. Good afternoon. This is Su-Wing Wu from Michigan, and very excited to be here. Thank you, Christoph and Urban Institute, for inviting us to this platform. And we would like, together with me, there's Dr. Olivia Ford and Alice Renville, 3 of us, and I believe we have another very our team member Sarah Lally was also in the today's sessions with us. So we were be sharing the process we find very useful and helpful in the listening sessions and how we done it. So we are one of the 31 recipient reached the recipient in 2018, and before that, our center has done work in promoting the health and well-being of the priority population Asian Americans, especially those underserved. And we have used the listening sessions, or in a more professional term called the focus group, in the previous cancer control and as well as the violence prevention. And we find this is a really good tool to kind of be where our community and our community residents, where they are. And so we also find this listening session after a few that we tweak and we revise and we implement the strategy accordingly to the results that we find from the listening sessions and surveys. And I'm going to pass it on to Dr. Olivia Ford, and she's going to tell you everything that you need to know that how we've done the listening sessions. Olivia.
Thank you so much, Dr. Wu. So as Dr. Wu mentioned, we are representing the Eastern Michigan University Center for Health Disparities, Innovations, and Studies. And we are a REACH recipient and one of the few, if not the only REACH recipient to be solely focusing on Asian Americans as our priority population. So we have up here on our slide, and it looks like our stars got shifted a little bit here. And in thinking about our geographic focus, so this first blue star over here on the right side of the screen, it should be slightly more to the, actually to the left here. We're not in, that's okay, you don't have to try to move it. We're not in Canada or the lake there. So we're focusing on the areas of Wayne, Macomb, and Oakland counties, which are on the eastern side of the state. Might be familiar with Detroit. So that would be Wayne County, and then Macomb and Oakland kind of surrounding the Detroit area. And then we're also working on the west side of the state in Kent County, which includes Grand Rapids. That would be probably the largest city that's in Kent County. And as I mentioned, our priority population is Asian Americans. And the key activities that we're going to be talking about today that we used for our community assessment are listening sessions and vaccine confidence surveys. Next slide, please. So we use the Centers for Disease Control and Prevention COVID-19 Vaccine Confidence Rapid Community Assessment, that's a really long title, guide that was provided. And so we use this to create a script for our listening sessions and also to create our vaccine confidence survey. We did also, though, tailor both the vaccine confidence surveys and some of the questions in our script for our listening session for our priority population. So for example, on our confidence surveys, when we were assessing race and ethnicity, we provided a much more comprehensive list of Asian ethnicities and subgroups. We also asked some questions related to racism, because as we all know, there certainly has been an uptick in racism against Asian Americans since the start of the pandemic. And additionally, we were able to translate the vaccine confidence surveys into 7 different Asian languages. We distributed the surveys at the vaccine clinics. So our team member, Sarah Lawley, who is on the call as well, is a registered nurse. And through her diligence, we were, as a team, able to run many vaccine clinics. And this is where we collected the majority of our vaccine confidence surveys. We did get some in addition through things like food distributions with some food pantries and community organizations that we are working with, but the majority were collected at the actual vaccine clinics themselves. And then we held the listening sessions with leaders and community members in Asian groups or Asian communities, and we held all of these via Zoom. So for example, we've had listening sessions that targeted the Korean community, Bangladeshi community, Filipino, and Burmese communities. And we are in the process of trying to set one up with the Thai community. Next slide, please. So just a few tips or techniques that we found helpful when we were setting up listening sessions and distributing the surveys. We worked very closely with our community partners, particularly to recruit individuals to be part of our listening sessions, which again, we ran all of these via Zoom. So for example, we worked closely with a community health navigator who we have worked with on other initiatives in Hamtramck, which has a large Bangladeshi population. And he helped us to recruit religious leaders to participate in one of our listening sessions. Again, our surveys were promoted largely at our vaccine clinics by our community partners and also volunteers. So when we were setting up the vaccine clinics, many of them were set up at locations that were familiar to and trusted by the community members. We had some of them at religious organizations, but also at community centers as well. And so we made sure that we always had volunteers who were part of the community at these events because they're trusted members of the community. But we also found it to be very important to have individuals at these at the events who were bilingual, who were able to speak languages other than English. So partnership and organization being very key. Again, we relied heavily on our community partners. Organization, there's always so many different moving parts, from who's going to bring pens in order for the surveys to be completed, who's going to print the surveys, in communicating dates and times and links for Zoom. I know probably most of us on the call are more familiar with Zoom than maybe some of us all want to be, but that's not necessarily the case for other members of the community. So it was really important for us to have a lot of these strong relationships with with community organizations. And so far we have conducted 5 listening sessions in the middle of scheduling a 6th. We have received over 500 completed surveys, and through the vaccine clinics have been able to distribute over 1,300 first doses of COVID vaccine. So I am going to now hand it over to my colleague, Alice Jo. Next slide, please.
Hi, everyone. I'm Alice Jo Rainville, and I wanted to share our virtual listening sessions toolkit with you. And my colleagues, Dr. Wu, Dr. Ford, and Rachel Baser, one of our team members, created earlier this month the virtual listening sessions toolkit. And I've got a link to it here. I don't know if I can put the link in the chat box when I'm finished. And we take you through step by step what we've samples of the script, the survey, step by step how to go about setting up your listening sessions. And again, as our Urban Institute friends mentioned, this is a big need that we've discovered, and we're happy to share our process. And the entire toolkit is linked on our website for the Center for Health Disparities, Innovations and Studies. So, and it looks like Olivia has posted the link. Thank you. Next slide, please. In summary, here are the lessons learned. As Olivia mentioned, detailed planning and communication are so important. And working with your community partners is important. You want to follow up after your listening sessions and surveys and share what you've learned and create programs based on what you learned as well. Consider cultural and religious norms of your priority population. And as we all know, in all of our programs in public health, some things don't go as you planned, but you just have to kind of come up with another plan and keep moving forward. But it can take a while to set up these listening sessions, but just sometimes when I thought, oh, this is never going to happen, our community partners came through with our list of participants, and it all came into place. So it's just important to be persistent, and you will be able to have successful listening sessions. So I believe that's my last slide, and thank you to Urban Institute for inviting us to speak today. This is our contact information. Feel free to contact us, and we'd be happy to answer your emails and share more information. Thank you.
Great. Thank you so much for sharing that toolkit. I can see there's a lot of interest. In the interest of time, we'll move on to the next speaker now.
Hello, everyone. Thank you so much to the Urban Institute for inviting NMQF SHC to join you today to talk about developing health champions. I will be going through several ways, including social media, that we have used to leverage this whole opportunity that we've created to build health champions in communities across the US. So next slide, please. So a little bit about the National Minority Quality Forum and SHC. So thank you for resizing. NMQF was founded in 1998 by Dr. Gary Puckrin, basically to use data to advance health equity in historically excluded communities. And at SHC, which is a center within NMQF, we use quality improvement in education and equity initiatives and interventions to do so in clinician training. Next slide, please. So for the CDC project, we decided on really trying to build education and training program for promoting equity in Black and Hispanic communities, really increasing flu and COVID-19 vaccination uptake in Black and Spanish speaking communities who suffer historic disparities and are hardest hit by COVID-19. Communication resources were reviewed and adapted as necessary to be culturally relevant to each population. And the gaps that we saw in these educational resources and communication resources really underscore the need for us to develop a Health Champions website and Drive toolkit. The Health Champions website is a toolkit in and of itself that I'll show you here shortly. And the Drive toolkit is a quality improvement tool that clinicians can use using the Rapid Plan, Do, Study, Act quality improvement cycle to improve vaccinations in their clinics. We developed a newsletter as well that's disseminated weekly. We've had nearly 15 or just over 15 webinars and promotion at our NMQF Health Disparities Summit. I also built a champion collab that I'll dive into deeper in the conversation in this presentation. And then engaging community leaders and clinicians as well as health champions. Next slide. So my transitions aren't going to show up on the PDF, so sorry about the crowded pictures here, but the very first thing you see in the top corner for Together We Can Stop COVID, that's our NMQF Health Champions Toolkit. And if you want access to that, please email me to let me know. It features culturally relevant and culturally appropriate tools for communication on social media and any other mass media for Black and Spanish speaking populations. We also have our Drive toolkit. We had developed previously a flu vaccination Drive toolkit for quality improvement in clinical settings. And so it was fitting for us to add the COVID-19 health outcomes and vaccination toolkit built into this program. We also, if you can see on the top right, the far right, that is our NMQF Health Champions newsletter, again, disseminated weekly since April of this year. And I should say that our Drive toolkit has been used by 422 users, about 2,725 page views, and users have committed to 653 sessions. And then lastly, our webinars, like I said, this particular one, the Facts, Faiths, and Fears webinar was our biggest hit. We spoke with pastors, faith leaders in Baltimore, and community health and health professionals in Baltimore to talk about COVID-19 vaccinations in their community. Next slide, please. So the planning process, we decided that we really need to understand what the need was for vaccine education for Black and Spanish speaking communities. We did an environmental scan to understand where the educational resources needed to be. And we had an advisory board that we still consult with that gave us insight into what was needed from those resources, how we can make them better. And they completed their suggestions through surveys. And we also developed those culturally appropriate and relevant messages through our communications consultant, Volt Lab. Next slide. And then we have, yes, I can share my contact info. I just saw that. So the Champion Collabs, it really focuses on building a ecosystem for what we like to call super champions of people who are medical professionals or public health professionals, really focused on equity, communications, and interventions, and also peer learning. So we'll be holding monthly learning labs beginning next week. And we will continue to engage the community at large around what is needed for their communities to increase vaccination uptake. Next slide. Okay, this is just the same kind of spiel that I went through. Next slide. These are also our members. Their names are listed here. They are fantastic. We'll be holding our first webinar with them on September 15th. Please let me know if you'd like to join the Champion Collab as well. Next slide. And our activities. So I'd love to share these activities with everyone on the call. Like I said, the September 15th, we just sorry, I have a crying baby outside of my door. But we just solidified the September 15th town hall for with Dr. Lisa Patrick and a couple of our health champions as well. One of the things I'd like to do is also develop focus groups in November and January. That's supposed to be 2022, sorry about that, and expand social media. Next slide. So what did we learn? We really learned that people are ready and willing to help, and they really want to be champions for vaccination uptake. Communities that have been historically excluded do have reason to not trust public health entities, and it's up to us to build those bridges. And the recruitment for Collab is ongoing. We'll need to recruit from a wider network. And what to keep in mind is we need to be able to incentivize people to participate and build community within their own populations. And I think what helpful materials and resources might be helpful to us is connections to wider networks. Next slide. And that's it. Thank you.
Thank you so much. Your household sounds a lot like mine.
Yes.
There's a few questions for you. And if you wouldn't mind, I'll tell you the questions and maybe you could type the answers in the chat so everyone can see,
yes.
And then we'll move on. The first question was, where is SHC located? Another is, what did your environmental scan include? And another is, what sorts of incentives have worked for champion participation? So if you could put that in the chat, and then also your email address, people can contact you if they want the toolkit. That'd be great. Thank you. And we'll move on now to our last presentation.
If I can get myself unmuted. And but I just wanted to send out to the Eastern Michigan University team. I am from Grand Rapids, Michigan, the famous Kent County. I just wanted to let you know that. So proud to hear from somebody from Michigan. But my name is Bernard Macklin. I'm the Outreach and Education Vaccination Coordinator for Southern Connecticut State Care Program, which you see here, Community Alliance for Research and Engagement. We were founded at Yale School of Public Health back in 2007. And since that time, we have moved over our programs over to Southern Connecticut State back in 2016. The care focus is to identify solutions to health challenges that fall within our communities using basic research and other approaches to receive this information. We also prevent chronic disease we work to prevent chronic disease with the focus on social, environment, and behavioral risk factors. And lastly, we engage residents in New Haven and low income. We engage with residents in New Haven and lower income neighborhoods. Next slide, please. CARE's mission definitely is to improve in New Haven among people most impacted by disparities, including people that look exactly like me and brown communities and low income populations through collaborative research practices and engagement. Next slide, please. The CDC, because of a lot of the disparities that roll through the New Haven community, the CDC created a grant throughout the country, and we were just one of the recipients of one other recipient that's in Hartford. that received the flu grant. And from that flu grant, the CDC created the COVID vaccination supplement grant to basically meet the needs of the community. We're getting our communities vaccinated. The goal was to increase COVID-19 vaccinations in New Haven by developing educational campaigns, implementing extensive outreach strategies, and increasing access to vaccinations. Through this relationship is how we form the partnerships with the community healthcare van, which is a van that we utilize to do mobile clinics throughout the city. Since that time, the Cornell Scott Hill Health Center has also created or established a mobile van that can actually help us go to very difficult places where there are not a lot of locations where we can go inside. So having access to these mobile vans have allowed us, through partnerships, have allowed us to get people vaccinated in very difficult high-risk areas in New Haven, which is basically within the ethnicities that we have, that we're considered to be working with through the CDC, which is Black Atlantic residents, due to disproportionate burdens of the CDC, of COVID-19 cases, hospitalizations, and death. I'm going to turn it over to my other associate, Jessica.
Thank you, Bernard. So can you go on to the next slide? So to kind of add more about the gap that Bernard was mentioning, so in New Haven, Black and Brown residents have lower COVID-19 vaccination rates than white residents, as you can see from the graph on the side. Black residents, only about 35% have been fully vaccinated against COVID-19. So before we even started any of like our outreach or any of our programs, we wanted to understand more about what the community saw as like challenges and access, and also, why or why not people wanted to get the vaccine. So we conducted multiple listening sessions, both in English and Spanish. So we actually planned to do 6 listening sessions, but because of the interest in the community, we were able to do 8 sessions with 72 community members. And particular, what we learned from those sessions is like there's this sort of issue around trust, and that comes from this historical and also present day mistreatment and racism from the healthcare system. And we also learned about logistical barriers and language barriers that prevented residents from accessing the vaccine, even when they wanted to receive it. And these were all compounded by the misinformation that people were receiving about the vaccine. Next slide. So taking this information, we decided to focus on a really community level approach by utilizing community outreach workers, or our boots on the ground. So these are community members who actually go, they knock on doors, they talk to residents, they visit community businesses, they participate in community events, and just talk to people about the vaccine and make sure they have information to know about mobile clinics that we have with partners, or know about where they can get information. We also created outreach materials based on what we heard in the listening sessions, and also what the outreach workers share with the larger team. So we actually have an outreach worker tracking tool where people can report anything that they heard from the community, anything that they found surprising, any sort of barriers that they identified. And based on all this different data that we've been collecting, we've been able to make a community-friendly COVID-19 website, which lists the different mobile clinics we're having, as well as information about the vaccine. And on a sort of wider level, while we do know that Black and Brown residents have lower rates of vaccination, we specifically identified neighborhoods in New Haven that were lagging behind in vaccination, and that helped us directly target certain communities for mobile clinics and make sure that people in those areas know where to go and how they can get a vaccine. And I'm actually going to pass it to my colleague to talk more about specific outreach events that we do.
Thanks, Jessica. If you'll go to the next slide, please. Hi, everyone. I'm Jackson. I'm the communications coordinator for CARE. So I thought what we could do is go over this event that we had to kind of highlight some of the other vaccination mobile clinics that we've had. So this event, Your No Cap, Get the Vax, was youth-led. We worked with a local youth organization called Ice the Beef. And Ice the Beef works with youth in New Haven to, their mission is to end the cycle of anger. but we worked with this youth organization to really come up with what this youth vaccination event was going to look like. Everything from the DJ to having spoken word and poetry to even some dance performances. They really, led the event and what it was going to look like. It was super successful, especially, with many community partners. We advertised through that network with partners on social media and through printed materials. Text messages were also sent out to parents through the local school district's text message system. And we also developed a how to have the talk with your parents about the COVID-19 vaccine. And this was a guide that kind of was a Q&A to help youth respond to their parents' questions or statements about the vaccine. And then we also developed an info card to advertise the community website Jessica was talking about. And this vaccination event was extremely successful. We had 75 vaccinations, about 35 of those were youth. At this time, this was back in June or early June, where mobile vaccination clinics, vaccinations were slowing, and we were past that initial surge, and we'd be lucky on a good day to have 10 to 15 vaccinations at a mobile clinic. And so we are extremely happy with this one. If you'll go to the next slide, please. I wanted to quickly run through some of the lessons that we've learned through all of our work. The first is, it's important to engage with community members and local organizations, especially organizations that are associated with the population that you're trying to increase vaccinations with. For the event that I just talked about, there's Ice the Beef, the local youth organization, but we also, the vaccination clinic was held at a church. And so that was well known in this neighborhood. And so it's really important to engage with these organizations that interact with these populations on an everyday basis. The other point, another lesson that we've learned is to make vaccination events fun. Getting a vaccine doesn't have to be scary, and for many people, I don't know many people that look forward to getting a vaccination, and so an added benefit of making vaccinations fun, it could draw people in that didn't know it was going on. And so we had another youth event that had a DJ, and it was in a more densely populated, like, residential area of New Haven, and people were coming by, just stopping in to see what's going on because they heard the music. And so just something like that can make the event even more successful. Another lesson that we learned was to work with community members to canvass the area ahead of and during the event. We found that oftentimes when we were doing this, that many residents even know that there's a vaccine clinic being held in their neighborhood. And so that, that could be the little extra encouragement that someone needed. One thing that we've learned specifically with that first youth event was to provide informational materials to parents and youth ahead of the event. So, it's vital that residents, especially youth, to know that how to have these conversations about COVID-19 vaccines with their loved ones, especially youth, since they would need their parent or guardian to be there to get the vaccination. And lastly, provide opportunities for residents to share why they got vaccinated. For some, getting vaccinated wasn't an easy decision. And so sharing their story may encourage others to get vaccinated. If you'll go to the next slide. At one of our events, we had this table where people, after they got vaccinated, could write why they got vaccinated. And we had a lot of local, earned media from that, covering just the event, but we were also able to see all the reasons why, to help with our own messaging going forward, what is the reason why people are getting vaccinated, especially the youth. And then there's a screenshot of the community website down at the bottom, and I put the link in the chat. And the next slide, please. And then here is CARE's contact information. Feel free to follow us on Facebook and Instagram. And
So I'm sorry, Jackson, go ahead.
no, go ahead.
Just so we don't leave out, there was a couple of questions on how we made it fun. We left it to be fun based on kind of things that you've created themselves with. When you seen that sign, we didn't create that. We didn't even know what it meant. But we met with a lot of youth before creating the event, and we asked them to come up with things that they would like to say and things that they would like to do. So at a couple of events, we have spoken words, we have rappers, we have dancers, all the things that they connect with that we probably no longer connect with at our age. But it's things that they connected with, what's made it fun, because they made it up, they came up with those ideas, and we went with it. And we found out that it turned out to be fun, even for us, because I threw a couple of dance moves, and I probably wouldn't do that again. But anyway, with that said, that's kind of how we made it fun. But we don't want to leave out, creating community partners is critical to success when it comes to establishing mobile clinics. In New Haven, we have mobile clinics and companies coming from areas that's not even part of New Haven, with the state jumping in and from DPH stepping in and bringing in mobile clinics from Griffin Health that's not actually in New Haven, plus our own 2 mobile clinics, plus a few others. It can become a problem because we are going to the same area. So we started to meet to ensure that we all wasn't showing up in the same areas of the city, so the population wouldn't be overwhelmed by us constantly coming to them and knocking on doors and things like that. So collecting and partnering was critical to our success and the success of the other companies and agencies that were involved as well. Thank you for actually inviting us. We're excited to be here. And if you have any further questions, please throw them out. We hope we can answer them.
Thank you so much. And I'm relieved that you didn't know what it meant, because that was my question. I was like, am I totally out of touch? But what does your no cap mean?
It's something these kids came up with, and we was like, what does that mean? And so we went with it. We put it on the sign because other youth would identify.
Is it a song? Or?
Ourselves, what it actually meant.
Oh, nobody knows what it means. No cap means no lie. Oh, okay. Thank you. I guess I am out of touch. I see.
Like, yeah. And then no cap, kind of in the language that definitely they understand. I thought I was with it. I thought I was still kind of in with the community. I found out that's probably not the case.
No, that's great. It sounds like you really were able to translate this into something fun and meaningful for them.
Definitely.
Great. Well, I see there have been questions in the chat. I guess you guys did my job for me. People typed in questions and answered them among yourselves. Not seeing any more questions. I really appreciate everything that was shared today. I know some people asked if this would be posted. They had to leave early. It will be. The resources will be. I'll try to compile the links too if we could post it with the recording. But such great information, such great work going on today. We are just so grateful to all of our speakers. So to end, we do have 2 poll questions we'd really appreciate if you could help us with. The first one is about feedback about today's session, just whether you found the information today useful. So if you can answer that question. And then the second question, so I think it will pop up in a box and then you can respond. The second question will be about our communities of practice, which are groups that we are planning to join, to launch soon. Where you can connect with others who are doing work similar to yours and share. So some examples might be through a dedicated page on the web platform, or we're thinking we'll have some virtual meetings that are smaller than today's. So hopefully we could get more discussion going among one another and also with outside experts as needed. So if you give us some input about what you think would be most useful to you in that way, we'd really appreciate it. So given that, thank you so much for your time, and I hope you all have a great day.